very loud. Good morning, everybody. This is Laura Yoakum. I'm the director of Wilson Public Library. Thanks for joining us today on our community chat. We have Lyndsey with the Two Rivers Health Department here today, and welcome.
Thank you.
You're going to talk today about who you are, what you do for Cozad, what you do for Dawson County, and we'll just ask questions along the way, if that's all right?
Yeah. Perfect.
Okay, we'll just get started then.
Well, my name's Lyndsey. I am one of the family support specialists out at Healthy Families Nebraska, Two Rivers. And this is the rest of my team. We have Brenna and Fatuma, and we are looking to hire one more. So if anybody knows anybody that speaks Spanish, that's what we're looking for.
Okay, that's good to know. So if somebody was watching this and they were interested, would they just call, get to your website?
I believe it's on the website, and I do believe it's also on Indeed.
Indeed.
Mhm.
Okay, good to know.
We work under the umbrella of Prevent Child Abuse America, and we really just try to work on childhood experiences and traumas in general to reduce abuse and neglect. This is one of our babies that we work with. So cute. One of Brenna's families. And just some things that we do in the home visits. We play a lot. We like to do a lot of learning through play. We want to make sure the family has understanding of any child development. We do promote well child checks and vaccines. And one of our big things is every month we try to do a family goal and see if the family has anything that they want to accomplish, whether it be in a week or a year. We try to work with them on everything with their goals.
I have a question for you. So do you work with the Department of Health and Human Services, or how do you find families to work with?
So we get our own referrals. Anybody can refer. They can refer themselves. If you knew anybody, you could refer them. I could refer somebody. And that's through the website as well, or there's a QR code at the end of the presentation. And DHS can also refer, and then we just work with all of them as well.
Okay. Do hospitals refer?
I've been on a home health visit before when I was in an apartment complex and was walking down the hall with a gal in her walker, and a young mom down the hall was leaving the building and stopped and looked at the baby in the baby carriage there, and baby had a torticollis, and the elderly gal had commented, yeah, it never really moves their head, it's always in that position, and so I made a referral through the school system therapist at the time, and then they went and checked it out.
Okay.
So, yeah, because we're taught in school, anybody can refer.
Yeah.
And here's another baby. This is one of my families that I work with. Oh, he's so cute. These are just some of the impacts that we try to do. They're just healthy childhoods, just make healthier lives in general. And this past year, we just completed a little bit under 400 home visits, which is really exciting because this program has only been active for a year. So we've been going.
So tell us a little bit about the Two Rivers Health District. What all do you accomplish? The area do you?
We do all 7 counties. It's somewhere.
It's someone there.
Yeah.
Oh, there we go.
We do all counties: Buffalo County, Dawson, Franklin, Gosper, Harlan, Kearney, and Phelps. So if anybody lives in any of those counties, we can serve them.
Have you made home health visits or home visits to all of those counties?
I believe so. I believe at least one family in each. I could be wrong. I think we're trying to get more families in the southern counties, but I believe so.
Sorry, I made you jump
No,
out.
you're good. And then these are some evidence that we found with the parents that we work with. It's improved mental health. We do like to not focus on mental health as much, but incorporate it into our visits because obviously like they can't pour from an empty cup. So we want them to be okay so they can make sure that their kiddos are okay. We try to help them cope with stress and kind of give them strategies on how to do that. And we also help them provide safe home environments, which is a big one. We do a lot of safe sleep checks. We try to make sure that when the babies are walking or crawling that they can't get into stuff. So we try to maneuver furniture and try to hide everything. Yeah, so we really just kind of focus on making sure everything's safe.
Do you do classes too, or do you just limit it to actually the home visits?
We don't do classes. Hopefully, if that's something that people are interested in, hopefully like in the future, we can do that. But for right now, we just do home visits.
I think, and I don't know, Robert, if you think this, but like first-time parents sometimes are clueless as to what all they need to do.
Well, and at the time they're discharged from the hospital, when we were delivering babies, we would do follow-up visits with our social worker if we felt there were some things that needed to be, shored up or need a little bit of help with, obviously if there's a true, medical concern and not just a social driver issue, then, we've done home health before with kiddos, but then also just, trying to be more proactive with making sure they get into their well child checks and making sure all the other resources they need are in place to help assist with, payment for medical services and things like that, so.
Yeah.
So with Two Rivers, you're providing just an extra step
Right.
that hospitals.
Right, and if we have these, we call them tools, but they're like ASQs, and so it's like ages and stages questionnaire. And if those are elevated, then we refer to either a doctor or like EDN, just to get further support that we can't service them for, but we can help support them. So like if they went there and they found something that works, then they brought it home, we could help them with that. Our program is free and voluntary, which is a big thing that I really like. We love working with everybody, but we just want to make sure that they know it's voluntary, because we've seen a lot of times that if people are like told to do something, they're not going to want to do it. We want them to want to do it. Our referral stages are from prenatal to when the baby's 3 months old and live in any of our districts. We can stay with the family until the baby's 5. So we're trying to bridge the gap of like between birth and school age is really what we're trying to accomplish. So when they're 5 and ready to go off to school, we leave them.
And at that time, they'd transition to an IEP.
Mm-hmm. And when they turn 5, they can graduate. No one's turned 5 yet. But yeah, and then we have different levels. So it starts off weekly, and then that's level 1, and then level 2 is every other week, and then monthly, and then every other month.
In a perfect program, When would you try to have them transitioned out by?
I really don't know. I mean, we want to say like as soon as possible, right? Like we want them to just keep hitting all of those marks where we're like, you don't need us anymore. But I really don't know. Like,
And some people just probably need more help than others.
and a lot of families just have more than one kid, and so it's just kind of building their support up so they feel comfortable to kind of graduate the program.
So when you say that people can, I'm trying to think what the word you used, like call you up and say, hey, I have this family.
A referral?
The referral,
Mhm.
thank you. What would I, as a librarian, be looking for families to warrant calling you for a referral?
I mean, you could even call if you see a mom with a newborn and multiple like toddlers. And you could be like, oh, I think that she could benefit from even just someone to talk to. Because all you would need to do is call us and give her name, or can be dads too. It could be anybody. Name and number, and if she lives in one of our districts, and we'll do the rest. We'll call her, ask if we have a screener that we do, and the last question is, are you interested in home visitation? And if she says yes, then we start. Then the next visit, we'll have her sign papers and she's in.
So is the referral, I mean, do you have anonymous referrals, or you normally have that person's consent to refer?
We have anonymous.
You have
We have anonymous. Some people tell them that they're going to be referred. I know a lot of hospitals tell them that they're about to be referred. Yeah, I think it just all depends, because we, or I don't tell them who referred them. I just say that they have been referred.
Okay.
But let's say Laura's got a young family in the library, and there's a 2-year-old that is still crawling and isn't walking yet.
Mhm.
That would be a perfect opportunity to
Mhm.
refer, because we've got delayed motor function.
Yes, and if there's any factors that to where they wouldn't be for our program, we would find the right people.
Do you guys have speech pathologists too?
We do not.
I was gonna say, that's generally mine, is the speech.
We do not. We just have us 3 family support specialists.
But you could.
But you can refer
Yes,
them.
yes, we can refer them.
That's
You can refer them back to the hospital.
Programs and.
Yeah.
That's one of our big thing is that if we can't do it, we will find somebody to help you.
Okay.
Yeah, those are our counties. And I did not bring any brochures, so that is my fault. But
That just means you can come back.
I can come back. I'm here every week.
You can stop it.
But yeah, here's that. And then we also have a board that meets quarterly.
Who's on
So-
your board?
Yeah. Do you have anybody from Cozad on your board?
I don't know exactly.
Well, how do you get to be on your board?
Years ago, Linda Benjamin used to be.
Okay.
I don't know if she still is or not.
I am not entirely sure who is on the board, but I can definitely ask my supervisor.
That's probably on your website.
It might be, yeah. And that's it. That's my supervisor's information, her email, our website, and then that's the QR code to refer somebody.
So that's just one aspect of Two Rivers
Mm-hmm.
Health Department, right?
Mm-hmm.
And how long have you been working for this department, or do you have other responsibilities besides healthy families?
I'm just with Healthy Families. I've been working with them since for a little over a year. So we've been trying to get this program up and running, and yeah, I think it's going good.
Yeah, well, it sounds like it, 400 visits in 1 year. I think that's pretty amazing. I'm trying to think of other questions I have. Do you guys have some questions? You're probably
I have
familiar
a
with.
personal question for her, but we can turn the recording off. Or do you edit that out?
I don't edit
Oh, you don't?
anything,
Okay.
no. So we can wait till the end. Jose, you normally have a lot of really good questions.
Going back to the beginning of your presentation, you said you were looking for someone that ideally speaks Spanish.
Mhm.
And I know, at least for the Lexington area, there's a lot of Spanish-speaking community members that would be interested possibly for that position. So aside from knowing Spanish, what other qualifications are you looking for that position?
I think, because I don't think they need a college degree. I think they just,
Would they need a car, or is a car provided?
we use company cars.
Okay.
Personal car, you can use personal car.
So they need a driver's license.
Driver's license and car insurance,
Okay.
so I guess a car. But yeah, they don't need a college degree. I think they just have to have
And interested in
experience
working with families.
working with kids and, yeah, I don't think it's,
So I would
It's
say, I would think Central Community College, somebody who's doing like early childhood, maybe they don't have a degree, maybe they're pursuing a degree, this would be something.
Haley used to, before she was a supervisor for this program, used to be a teacher. So just kind of anyone that.
Education. I would think that you gotta like kids.
Huh?
You gotta like kids.
You do have to like kids.
Okay, all right.
You do have to like kids.
And I say that you have to say that because some people might, hey, I can drive, I have a driver's license, I can speak Spanish, but they don't like kids.
Because at the beginning, I was like, oh, I get to hang out with babies all day. Well, those babies usually have siblings,
Yeah.
and it is a full house. So, yeah, you gotta like kids.
How has things changed for you before the pandemic versus now after the pandemic?
Like with the program?
Yep.
The program was started last October.
Oh, okay.
So we have not,
So you are only post-pandemic.
we are only posting.
In your personal opinion, has the need gotten greater since the pandemic?
I think more people are more open to help and know where to look for it, if that makes sense, more, because during the pandemic, people were always looking like, especially with like money and financial situations, they'd be looking more, and so I think that they figured out, oh, well, I can look here if I need something, and then they find us. So I think they're more open to help since the pandemic.
When you graduate those students, do you give them more resources, like names of resources, like if you need further help, this is where you would go? Or does Two Rivers have a different program for older kids?
We do not. We do refer out if we cannot, if we do not have.
Right, like the occupation.
Yeah.
person.
So there's Compass, I know, that's right next door to us. And when they do graduate out of the program, that's usually when they're heading to school. And so the schools will also have their own resources.
What do you think the biggest concerns are of the families that you've worked with?
I work with a lot of families that have multiple kids. And I think sometimes the stress and being overwhelmed can just cause them to just not want to. And so I like going and seeing them once a week and hanging out with them and giving them all the reasons why they can, and helping them know that they can. Because my goal with the families I work with is I want them to be able to leave the program and knowing what to do, how to do, and that they can do it. Those are my big things.
I noticed your pictures, a couple of them, they had books.
Mhm.
So is that something you do with parents, is like talk about the importance of reading to your child? Do you do anything with the libraries in your communities as far as letting parents know that like there's story times available that they could take their kids to, or different programs that they can use that are free?
I've mentioned the libraries, but I haven't specifically said any story times, just because I don't know the schedules a lot of the time, so I'll get them. But yeah, reading is definitely something that we like to emphasize.
And I just say that because, you were saying that people find you, people can find us
Mhm.
too if they're looking, but sometimes it's just somebody reminding
Right.
them that there's that opportunity.
And our visits don't have to be at their house. They can be anywhere public. I have a lot of visits at like coffee shops. I know Brenna has a lot of visits at libraries. But like I said, a lot of my families have multiple kids, and so they don't want to go in a library. But, yeah, so we have visits here.
That's one thing is, there's a lot of family visits at our library, but
Mhm.
rarely do we know, if it's DHHS visiting or if it's Two Rivers. I don't think I've ever known that Two Rivers visits. Can you walk us through what a normal visitation looks like?
So with Healthy Families, we have this curriculum with Growing Great Kids. And so it's books from prenatal all the way up until they're 5.
So it is kind of like a class.
It is, but we can't call it a class.
Okay. It's individualized.
Right.
Instruction.
Right. And so those books just have different chapters. They're over bonding or self-regulation, or, oh gosh, I'm gonna blank. A lot of things, like overstimulation. There's even chapters like in the older books about screen time. And so we every visit, we just go through those questions, or we have activities that we do, and then we just kind of check up on the mom and the kids. And
Do you do anything with nutrition?
we do, but not like specifically. We make sure that, well, I guess, I haven't. I don't know about, Brenna and Fatima has not started seeing families yet. But I emphasize.
You haven't pulled out your inner Julia child?
I haven't, not yet. All my kiddos are still young. I just got, actually last week was the oldest one's first birthday. So they're still not eating yet. A lot of them are still on milk and purees. But yeah, we talk about food, and a lot of times I talk about food with the families and not just the baby, because we want them to be as healthy as they can be.
Absolutely. Well, this has really been interesting. I didn't know anything about this aspect of Two Rivers. You probably did.
Not so much this aspect of it. So what other services does Two Rivers provide as a whole?
Two Rivers does a lot of things. There's a dental program, there's environmental health programs, there's nurses, so there's vaccine clinics, and they go out to the schools. And
So those are all still for families though?
Mhm.
Yeah, so and I know this isn't your area, but like when you said dentist, what do they do for that? Is it same thing? People
for-
reach out and say, I need help.
For dental programs, they go out places, and set up like a dental clinic, and then anybody can go.
How busy are those clinics?
Last I heard, they were pretty busy.
Because in an era where very, very, very few dentists
Even have any
will
openings,
accept
yeah.
Medicaid insurance, that's a huge
Yeah,
group of people that are not getting the dental care they need.
Right.
And so I would think you would just be swamped, whichever community you went to, you could just stay busy all the time doing that.
And so I don't know a lot about how the clinics are, just because there's none in-house. So they go everywhere, and I've never been on one. But I do know that they've been busy in the past.
do you know, Robert, has there ever been a dental clinic here in Cozad?
I think at one point in time when Tim Davis first got started, he accepted Medicaid for a short point in time, but as far as a Two Rivers clinic,
Right,
I'm
Two Rivers
not,
Clinic.
yeah.
I
don't
haven't
think so.
seen anything, but that's not saying that
Yeah,
they haven't been here before.
I haven't heard about it. And if so, it's something that our medical clinic would like to know.
Well,
because
that was my question.
They see a lot of people that, and quite honestly, we get stuff from DHHS dental kits provided to us. So at the last Nebraska Hospital Association meeting when we were in Omaha, as we're leaving the door, they're giving huge boxes of dental kits to every person leaving to take back to their facility, to give out to their community. And there's frustration there because when a physician's doing a well child check, they have so many other things to focus on other than dental stuff. But now they have to try to provide that too, because most local dentists that are in private practice are not going to accept Medicaid. And so then our providers feel obligated to try and do that as well, knowing that's not their specific educational skill set.
So my question is, knowing that, and knowing you said you can like self-referral, can communities reach out to Two Rivers to say, hey, we'd really like a dental clinic held in Cozad? Do you know how that works?
I would believe so. I don't see why they wouldn't at least look at it.
Yeah.
Um,
Or how do they pick which communities
Right.
have dental clinics?
I really do not know how they pick. I know that I think they try to go everywhere, but I do not know how a community would say or like refer or.
Or where that would be
Right.
held then, I mean, because.
Well, I know they do a lot. I think they've done some in like churches, just like big spaces, wherever they can, I think is where they try.
Okay.
And then how are those staffed? Do you employ your own hygienists? And, okay. Are they able to take x-rays? Do they have a mobile x-ray unit, or they're just doing cleanings and assessments and then referrals from there?
I believe it's just cleanings. I could totally be wrong. Don't quote me. But I actually do not know.
Okay.
So it sounds like that might be something worth our community to look into.
Yeah.
So, I don't know how big of an area they need, but.
The Catholic Church would be appropriate, and they
Yeah.
received funding as a result of the pandemic to host things like Blood Mobile and something like this.
Yeah.
So I would think they would be a great spot to go to.
So what I hear you saying is there's way more to Two Rivers than you even had time for today, so we should really go check the website out. Is that right?
Yes, and then you can find even things that I forgot about for our program as well. But yeah, everything should be on there.
That was a great question, Robert. Do you have any others? Or? Okay.
Tell us about Two Rivers' role
with emergency preparedness.
Gosh, you're just hitting me with all the hard ones. They're on the
It's kind of Jeremy's wheelhouse, I know that, you know.
they're on the whole other side of the office.
Okay.
But I do know that, there's a couple people there that do it. I don't know what they do exactly.
So maybe I need to have them come in and talk about what they do too, huh?
Yeah.
And I only say that because we kind of got hit with an emergency this summer. You guys, did you get your roof done yet?
The roof over it's done, but everything underneath hasn't been started yet.
Yeah. We're still waiting on a roof.
Yeah.
Was it the hay?
And that's just the area that was damaged. I mean, now they're working across the rest of the roof, but yeah.
When I came back to town after that happened and everything was boarded up,
Looked like a war zone, didn't it?
I was like, oh my gosh. Like, I didn't even, and all the cars.
Yeah.
I was like, gosh. Yeah.
Well, Haley, Lyndsey, we appreciate you coming today.
Thank you.
And if there aren't any other questions, and you would like to talk to her when we're done, go ahead and end this for today. Thank you for joining us.